My name is Iridel Gonzalez. I'm a pediatric nurse practitioner. I speak English y Español. I've been working as a nurse practitioner for 5 years. I know that my name is a little bit difficult to pronounce, so I go by Iris. Two specific areas that I enjoy the most working on is sexual health or sexual education, and also developmental delay, and also autism. And sexual development, because in my family, my mom was a nurse practitioner, and I really, thanks to her during the process of growing up, for me was a blast. For me was an easy transition because she was always there to educate me and to let me know what were the changes that my mind and my body was going through. So for me, it wasn't like a challenge for me. I enjoyed the transition. I enjoyed the process of growing up and maturing and changing. I always knew that I wanted to go into medicine. My inspiration was my mom. She's a retired nurse practitioner, and I knew that medicine was my call. What I love the most about working with kids and families is that you can enjoy the process. And the way that you enjoy the process is that you can be part of their life in such a good way, because you bring resources and solutions that can help. My role as a provider and my role as a mom, the two of them that really guide me to. As I tell my patients, kids that don't come with a set of instructions, we are learning as we go. I think that being a parent have helped me to grow as a provider. So thanks to my kids, I'm able to provide a good service and kind of like a way of support to the parents and my patients when I see them. I will tell them kids are like a diamond in a rough. Sometimes they have to be constantly be worked in order to shine. Please do not give up on them. That's the way that I see kids. It can be a little bit complicated, and it's a complex process. The way that we are trained is just to take about the physical, but not think too much about the mental. With society now, as a provider, I've been learning that in order to take care of my patients and the families, I have to try to understand and help them to navigate through the physical changes and also through the mental challenges that not only the kids are going through, but also the parents. One of the things that I wish that the parents will know, that it's okay to reach out to the pediatrician. Another thing that I wish is that the parents that they come to see us, they know that we have the service of the triage care, that they will call and they will answer all their questions. And if they don't have the answers, they have also the providers here. And what I like about it is that they're just close to each one of the providers just by asking their questions. The triage nurses, they're gonna make sure that they reach out to the providers and get those questions asked, and answered. They're gonna get it. They're gonna make sure that they reach out to the provider, and we're gonna be able to deliver their question and the reassurance that they need.